This is a 50mm dry needle that I use in my physiotherapy practice. Does it hurt? Is it safe? And what is it actually doing to improve my function? And with some of the criticism that's seen on social media, do these people have a point? Maybe you're seeing this video because you're wondering if dry needling can help improve your function. Or perhaps you've had it, and you've had a positive outcome, but you're wondering why the pain from your initial injury has a tendency to always come back. Today, I want to reveal exactly what you need to do to maintain the improvements following your dry needling session, demonstrate what treatment looks like from start to finish, and answer some common questions I receive about dry needling in physiotherapy. First, dry needling is a treatment performed by physiotherapists and some doctors for the intention of treating painful trigger points. A trigger point can be defined as a hyper-irritable spot on a taut band of muscle tissue that is uncomfortable on stretch, compression, or contraction of that muscle. We've probably all felt this at some point in our lives, this taut band of muscle that just doesn't go away no matter how much we poke or stretch it. Trigger points can also contribute to functional impairments, such as altered muscle contraction, accelerated muscle fatigability, and increased muscle antagonist activation. We'll get into what exactly that means and how that affects our function later in the video. But first, I want to explain the physiology, or what exactly is happening within our body during the dry needling process. When a trigger point is hit with the dry needle, a twitch response occurs, which is a reflexive contraction of the muscle, which is supposedly mediated from a reflex from the spinal cord. And when this occurs, there's a whole cascade of events that happens within our body in order to promote healing. First, it is suggested that the twitch response modulates the muscle tissue itself by improving its contractility and restoring the muscle to its natural resting state. Beneficial neurochemical effects take place, such as improved circulation, decreased levels of acetylcholine, and a reduction in noxious substances. Acetylcholine is a chemical mediator that is responsible for achieving muscle contraction, and in trigger points, it is theorized that an overabundance of acetylcholine is present at what's called the neuromuscular junction. This is the location where the nerve ending meets the muscle, and too much acetylcholine is theorized to be one of the reasons why the muscle turns into this knotted, contracted state. Second, from a pain management perspective, dry needling is able to reduce what is called peripheral nociception at the spinal level. Peripheral nociception can be explained as the process where pain signals travel from the site of injury to the spinal cord and the brain to alert us that there's a problem within this area. A reduction in this peripheral nociception, or this dampening of the pain signal, results in a decrease of the spinal dorsal horn neuron activity, which is a region in the spinal cord that processes that excitability of the pain signal. Upon the twitch response, messages are sent from the site of the injury to the dorsal horn neurons, and there is this general dampening, not just at the site of the tissue injury itself, but also in its surrounding muscular tissues. And lastly, a decrease in pain excitability leads to positive changes in the brain. There's also a deactivation in regions of the brain associated with pain and discomfort, and so to summarize, there are 3 key regions in the body that are positively affected by dry needling. There are improvements in the quality of the muscle tissue itself peripherally, improved signaling at the spinal level, and improved sensory motor processing at the brain. Alright, so maybe you don't care about any of that. You might be asking yourself, with dry needling, how is it that I'm able to better work out and exercise to the intensity that I want? I briefly mentioned how trigger points can lead to an increase in muscle fatigability, and it causes an increase in antagonist activity. An antagonist is a muscle that's supposed to relax during contraction of the agonist, which is known as the prime mover. And I'll give you a quick example. When someone goes to perform a squat, what should happen is a relaxation of the hamstrings and a contraction of the quads and the glutes. Of course, this also depends on your form. In the example of the squat, the hamstrings work as the antagonists. So in practice, for someone who has chronic hip irritation, perhaps there's discomfort when they go down to do a squat task. During that movement, they might feel excess antagonist activity, such as contractions of their hamstrings or their groin muscles. An assessment should be conducted to identify if the quality of movement is optimal by assessing if the femoral head is centering well during the squat task. If it is not, it's likely there's a taut band of muscle that is positioning the head of the femur slightly off center. A physiotherapy assessment should be conducted to identify if the driver of the injury is truly a result of the trigger point near the hip and the pelvis, but let's assume that in this scenario, we have assessed the rest of the body, and the hip and pelvis is indeed the problem. Once the top band of muscle is identified, we use dry needling to treat the trigger point. Here, I'm using stanhexidine to prepare the skin, which is a combination of 2% chlorhexidine with 4% isopropyl alcohol. With the dry needle, I pass through the subcutaneous layer into the muscle until I feel tissue resistance with the needle, and then gently adjust the needle depth until I feel a twitch response. Different areas in the body will require varying needle depths, but here I'm using a 40mm dry needle to reach the band of the muscle in the iliopsoas. Upon a retest of the task, the muscle activation pattern should improve. There's often a feeling of the hip moving better, and that you can squat with minimal accessory muscle recruitment. It is hypothesized that dry needling can improve the awareness of the normal muscle function in the muscle, which helps reprogram the brainstem to incorporate the newly restored full-range capabilities of the muscle into exercise and daily activities. In order to understand how well a treatment works, we tend to look at the research. Specifically, clinical guidelines are intended to tell us how well a treatment works, and these clinical guidelines are often based on what are called systematic reviews. A systematic review is one research paper that has compiled several, and often hundreds, of research papers looking at the effectiveness of an intervention, and then it provides a conclusion based on the statistical averages. In a 2021 systematic research review looking at the effects of dry needling, the outcomes of dry needling on pain in various regions of the body were recorded on the weeks following the treatment application. Generally, there is predominantly low, but some moderate quality evidence that dry needling has a large effect on pain levels in the immediate to 24-week window after its application. In another 2023 systematic review, the researchers found there was again low quality evidence suggesting a moderate effect favoring dry needling over a control group for up to 12 weeks post-intervention. In layman's terms, a low level of evidence means there is limited confidence that the intervention provided, in this case the dry needling, is what solely caused the positive outcome. It suggests that a positive or a negative outcome could have instead been due to other variables, such as one's movement routine, perhaps one's quality of sleep, or just maybe their innate ability to recover over time. For example, evidence might be judged as low quality if any of the following applies: the studies have major flaws or limitations, or if there is important variation between studies, or if the confidence interval of the summary estimate is very wide. That's not to mean that dry needling is not effective. It is clear from the data there is a large improvement on pain, but rather, limitations in the research methodology automatically disqualify the evidence from being considered high quality. The authors in the 2021 study openly admit this, and note that a systematic review has several unavoidable limitations. An important limitation is the high heterogeneity of the analyzed studies, or in other words, the large number of study types that are included in the review. There are so many variables that can influence the outcome of treatment, such as the skill of the practitioner, region of the body that is being treated, extent of hypertonicity in the trigger point, and not to mention the tremendous variability amongst patients such as age, fitness levels, previous injury history, stress, pain tolerance, and the list goes on. These authors suggest that the current results cannot be generalized to different populations of patients treated by different professionals with varied training in dry needling. More precise study is required, such as consistency in treatment dosage, selection of treated muscles, chosen outcome measures, and the list goes on. In other words, you can see how it is almost impossible to get high-quality evidence from a systematic review, and if we rely solely on this broad method of data analysis, it's easy to dismiss what can be very effective treatments. Despite the flaws of systematic research, we do get a general sense that dry needling is quite beneficial, especially in the short term. However, as time passes, the positive effects tend to diminish. If we think about it, this is probably because our bodies have a tendency to revert to our old ways of holding tension if we are not actively changing the way we recruit our muscles. Which means, you guessed it, there needs to be an active component to this treatment plan. For example, let's say you have shoulder pain, and you've been getting massage therapy or dry needling, but your job is to lift heavy for 8 hours a day, 5 days a week. Your shoulder is going to be tasked with doing more than it wants to do. So it never gets a chance to calm down, so there's this perpetual cycle of progression and regression. In this scenario, it's common to experience relief from dry needling for a few days, but then the pain has a tendency to come back. And if task modification isn't possible, then it's of utmost importance that you begin an exercise program to build stability to the region of the impairment. So if exercise is the key to creating this long-lasting change, you might be asking yourself, can I just do a bunch of exercises to this surrounding musculature and that the trigger points will eventually go away on their own? That entirely depends. I'd highly encourage anyone with myofascial pain to try different exercises of varying loads, postures, and movements, and you might have some success with this. But depending on the extent of the injury, you might feel tension that doesn't feel like ordinary muscle tension from a workout. Shaking, fatigability, and weakness are often clear indications that you're recruiting your muscles suboptimally. And this is where dry needling can really help your brain and nervous system by inhibiting the muscles that are working in overdrive, thereby allowing you to achieve better muscle contraction. Let's go back to our example where I needled the iliopsoas muscle. If the head of the femur is seating better in the socket after needling, it should allow different muscles such as the glute max to recruit. Recruiting and ultimately hypertrophying the glute max muscle can reciprocally inhibit the hip flexors, resulting in less activity of the hip flexors with enough practice. Here, we're using a reverse lunge task with the front foot elevated to encourage the femur to glide as far back into the socket as it can. So dry needling is generally very safe when conducted by a physiotherapist with proper training. Contraindications and precautions to treatment do exist, and these should be discussed with your physiotherapist prior to treatment application. The most common undesired effect from dry needling is that post-needling soreness that can happen after repetitive damage to the neuromuscular tissues. The post-needling soreness generally feels like a mild bruise, and sometimes it can last for up to 48 to 72 hours, with some research to show that low-load exercise can help with the post-needling soreness for after 12 hours. Keep in mind that the feeling of post-needling soreness is highly variable between people, with some people that I see in the clinic reporting that they don't feel any soreness whatsoever. And another question I commonly get asked is, how many times should I see you for dry needling treatment? And this again can be highly variable depending on the individual. The authors of the 2021 systematic review noted that dry needling 2 to 3 times in the first week is superior than receiving needling 1 time a week. Then, in the 1 to 3 week period after starting treatment, 1 time a week is suspected to be enough to promote healing. Keep in mind that performing daily routine movement and exercise will speed up your healing, and that the more you do, generally the less dry needling you actually need. And so to summarize, dry needling can get you to be more efficient with your exercises, and a few treatment sessions can be highly beneficial to get you on the right track. Most physiotherapists will recognize that dry needling should be used as an adjunct to the entire treatment plan and not as a standalone treatment. And if you're watching this video and you haven't had even a little bit of success with dry needling, you probably need to see a physiotherapist who's better at applying the procedure, identifying the driver of impairment, or providing the correct exercises necessary to get you out of pain long term. If you like this kind of content, please feel free to drop me a comment and let me know what else you want me to cover in the future. Thanks for watching, please like and subscribe.